Good afternoon, everybody. How we doing? It's good to see all y'all here. Thank you for coming today. So I do want to take the opportunity to give a special thank you to Chin for allowing me to give you guys this talk today. It's a subject that I'm passionate about. Definitely drove my desire to go into medicine, and a lot of the people that drove me into medicine lived right here in Meridian, so it's great to be home. So we'll start with this importance of this topic. So I want to delve a little bit into a topic that affects millions of people worldwide and has a significant impact on right here in Mississippi. So diabetes, as we can tell today. In our state alone, according to recent statistics, approximately 15% of adults in our state, so that's about 345 to 350,000 people, have been diagnosed with diabetes. That ranks Mississippi among the highest in the nation for diabetes incidence. What's more concerning is that many more individuals may have diabetes or prediabetes, putting them at risk for development of full-blown disease. I also want to talk about the fact that this hits a lot of us at home. You know, one of the big reasons I was happy to do this is the state of the community. And that involves all of our friends and family. And so very precious to me is my grandmother, Glenda, who we lost roughly 20 years ago yesterday to the complications associated with diabetes. So this is very much an issue that's near and dear to my heart. So the high prevalence of diabetes in Mississippi has substantial economic impacts as well as the things it causes in our lives. The cost of medical care for diabetes to Mississippians is staggering. It's amounting to the millions of dollars per year, and according to the American Diabetes Association, it's estimated at roughly $3.4 billion a year just for the state of Mississippi. These costs encompass expenses related to hospitalizations, medications, doctor's visits, and treatment for diabetes-related complications such as dialysis, amputations, and loss of life. One of the things you'll notice here on my slide is, and it's very hard to see, I know, but this is essentially a heat map of the death rates according to the 2018 to 2022 census related to diabetes. And I don't know if you can tell from back there, but Mississippi is mostly dark red. So we have quite a few people involved with this. And I'm sure almost everybody in this room can think of somebody off the top of their head. One of the big factors of this involves the obesity rates. As you can tell, it's no coincidence generally that these darker lines line up with some of the higher poverty areas in our state. So it's something very important to me, and one of the big reasons I was so happy to come home is because we didn't have an endocrinologist in the area. And so bringing our population closer to healthcare, or more our healthcare closer to our population, is important to me. One of the other things we'll see here is that the Mississippi State Department of Health is doing a good job of trying to educate people as well. They have a lot of resources on their website that can kind of point you in the direction for more information if you leave lacking any today. So like we talked about with the economic impact, one point I wanted to make on here as well is that annually it's estimated roughly 17,350 new patients are diagnosed yearly, and I have a grave concern that is probably less than 50% of those that actually are diabetic each year. As you'll tell here too, they estimate the expense to each and every one of us in this room that develops diabetes at roughly $13,000 per year. I don't think I have $13,000 to give away either, and I know a lot of people in this room don't. So it's something that I'm really passionate about, not only preventing, but getting in front of so that it doesn't take over our lives. So let's take a minute and kind of break down the different types of diabetes. I think there's a lot of confusion, not only in the community, but amongst patients and even some providers. But essentially, the diabetes breaks down into some basic types. You have what we would all kind of consider pre-diabetes. You have type 1 diabetes and type 2 diabetes. So what is diabetes, though? Essentially, diabetes is an error of metabolism involving insulin, which is a hormone just like anything else, such as thyroid, adrenal gland hormones, testosterone, estrogens. So, you know, we all may be asking, well, Dr. Lott, how do I even know if I'm diabetic? Well, generally your primary care provider, whether that's a doctor, nurse practitioner, primary care associates, whatever that may be, will check your routine lab work on most of the time our routine physicals, such as our wellness visits. Some people can have this checked at health fairs or even at urgent care or emergency room in those troubling times. There are several tests that we can run when we look for them, but usually they involve a random finger stick glucose. I'm sure several people in here have had to do those. Those are not fun. But that value is generally over 200. A fasting blood glucose, so something where you didn't eat for roughly 8 hours, that's greater than 126. An A1C which we're all probably heard of before, greater than 6.5, with prediabetes being about 5.7 to 6.4, or an oral glucose tolerance test. That's generally what the ladies in the room have been through when they went to their OB-GYN doctor during their pregnancy. Usually we prefer to see these values done twice to diagnose. However, sometimes just the height of the value or the severity of it is enough to make a diagnosis. So let's get a little bit more specific then about the types of diabetes and how they're different from each other. So prediabetes is generally a condition where blood sugar levels are higher than they should be, but not high enough to necessarily be classified as type 2 diabetes. It's often the precursor of type 2 diabetes, and it serves kind of as a warning sign that if we don't address this now, this will advance to severity of type 2 diabetes. Lifestyle changes are crucial here. One of the big things that I like to do in my clinic is really focus on the things that are free and are easy to do and really help not only our health, but our spiritual lives as well. So diet, exercise, spending time with family, things like that. These lifestyle changes, as you know, involve balanced diet, increased physical activity, and maintaining a healthy weight. Regular screening for prediabetes is important for early detection and intervention. Now, type 1 diabetes, on the other hand, is an autoimmune condition where the body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. These are considered and called beta cells. It's not important necessarily that we all leave knowing that, but that is the key difference in that in type 2. And as a result of that, the body essentially makes no insulin, providing and requiring lifelong replacement of that. It wasn't even that long ago that we didn't have this as an option, and children would be put in wards and unfortunately left to die due to complications. Mm-hmm. It was the miracle of somebody deciding to grind up a dog pancreas and inject it into a child who lived that we discovered insulin, and were able to produce it. Managing type 1 diabetes involves monitoring blood glucose levels closely, administering insulin as prescribed, and balancing insulin doses with food and physical intake, physical activity. Advances in delivery of insulin have made things a lot easier for those that are type 1 with things like insulin pumps, continuous glucose monitors, which we'll talk a little more about shortly. And it has greatly improved not only the management of type 1 individuals, but also their livelihood. Now, one of the things, and again, I didn't want to get too biology deep on everybody today, but you'll notice in these pictures, essentially the problem is diminished insulin, or frankly, you could take those even away because there is no insulin production. That leads to the body's inability to take glucose out of the blood and put it into the cell, which is what we use to produce energy. That leads to diabetic ketoacidosis, which can be deadly if untreated. Now, type 2 is a most common form by a long shot. It's characterized by insulin resistance and relative insulin deficiency. So the big difference being you produce insulin, but not quite enough for what your body needs. It's often associated with lifestyle factors such as obesity, physical inactivity, and poor dietary habits. Type 2 diabetes can be managed through lifestyle modifications, oral medications, injectable medications, and in some cases even insulin therapy if needed. Again, lifestyle modification includes adapting a healthy diet, engaging in regular physical activity, and maintaining a healthy weight, and stopping smoking, which is surprisingly a big factor in most type 2 diabetes patients that smoke. These changes can help improve insulin sensitivity, lower your blood glucose levels, and reduce the risk of complications in diabetes such as heart disease, stroke, dialysis requirements, etc. In addition to lifestyle modifications, medications such as metformin, sulfonylureas like glipizide and glimepiride, GLP-1s like we have all heard, Ozempic, Mounjaro, Zepbound, and SGLT2 inhibitors such as Jardiance or Farxiga may be prescribed to help control your blood sugar levels and improve insulin sensitivity. These medications work by various mechanisms to lower blood sugar levels and reduce the risk of cardiovascular events in individuals with type 2 diabetes. So the picture above, again, I know these are a little bit hard to see, but you'll notice the big difference is there's plenty of insulin present. It just isn't doing its job because there's a defect in the signaling there that doesn't allow the right amount of insulin to come out of the bloodstream and into the cells. That's what leaves the blood glucose that we measure with our sensors so high. Essentially, you're starving the cells of your body from the primary source of their nutrition. So I won't beat you guys over the head with that again, but it's important to realize that insulin is the primary issue here. It's produced by the pancreas, like we said, and it plays an crucial role in regulating our blood glucose levels. When we eat, our digestive system breaks down carbohydrates into glucose. So one big comment I will make about carbohydrates is it's not always white sugar that we talk about, right? A lot of my patients, and I'm sure people even in this room, have a misunderstanding of what a carb is. A carb can be anything from a bowl of white sugar to one of my favorites, a fried okra piece, right? You got plenty of carbs on that. So it's important to know what is a carb and what is not a carb. Essentially, though, anytime you ingest anything with a carb, and even sometimes proteins, you'll see a rise in your glucose. And the key being that insulin is the lock, and it has to be unlocked to allow that glucose into the cell. That process is obviously disrupted in type 2 diabetes as well as type 1, and you become less and less responsive as your body has to make more and more to respond to it. Over time, chronic hyperglycemia, such as high blood glucose, can lead to damage to your blood vessels and organs, and this increases your risk of complications such as heart disease, stroke, kidney disease, and nerve damage. So you may be asking, okay, well, that's great. You told me how to be diagnosed. You told me what it is, but what do I do to prevent it from developing type 2 diabetes, and how do I manage it if I already have it? So one of the big things that I noticed when I was looking for pictures today, or not today, a few days ago, for lifestyle modification is it's always this real bright sunny day with all the fresh fruits and vegetables, like we all have a million hours a day to go harvest our garden, etc. That's rarely the case, and it's rarely the requirement that you need. One of the biggest things that we each individually could do, and I'm talking to myself as well here, is work on how we handle this situation here. It starts at the grocery store, okay? On top of that, we could be a little bit more cognizant probably of some of our favorite foods. I know this one's a weakness for me. I'm sure other people in this room. That cornbread that Grandma makes is pretty tough not to eat. But also things like sodas, as you can see here. Those sort of things with high carb intake and generally constitute poor choices. So this all plays a role in lifestyle modification, and it's not always something like, a lot of the providers, and I've been guilty of this in the past as well, will just say, well, you need to eat better and exercise. Well, what does that mean? Things like avoiding high sugar, high fat, processed foods, some of our favorite things I know here in the South, will go a long way. And when we say exercise, we don't necessarily mean you need to go run a marathon, but simply walking at a brisk pace for 30 to 50 minutes, 3 to 5 times a week will generally be a significant life change for people. I point out too here, this is not a local grocery store, but having grown up in the grocery business, I'm sure some of you know my father, David Lott, we have seen quite a bit of that same stuff involved in even our grocery stores. So the key to all of this, because I know not everybody lives next to a farmer stand or has a garden in their backyard, is moderation, right? It's all in moderation. So, one of the big things I tell my patients is, would it really hurt you to remove what I call leaded Coke from your diet? Or your sweet tea to be a half sweet tea, things like that. Those sort of small life changes make a big deal, especially in prediabetes. So one of the things that people like to talk about in these kind of talks, and I won't get too in the weeds for you guys, but I'm sure some of you have questions, will be, what about the medications, Dr. Lott? I hear a lot of bad things online. I see a lot of things that I just don't trust them. The pharmaceutical industry could have done a better job during COVID. They've made me scared. I like to really talk about that kind of stuff with my patients and ensure them what is good, what maybe isn't so good, and spend time individualizing what is important for you. So, one of the things, we'll kind of be generic here, but for those with prediabetes or type 2, medications can be prescribed to help lower your levels of glucose and improve your sensitivity. The improving of sensitivity of insulin is key. Metformin, which is a very commonly prescribed medication, works by reducing glucose production in the liver and improving insulin sensitivity in the muscle cells. So like we've talked about in type 2 diabetes especially, because you don't use metformin in type 1, the insulin sensitivity is the key. Metformin gets a lot of bad raps online. One of the things I commonly hear, even from other providers, is that metformin causes kidney damage. That is not true. That is not true. Metformin is dangerous once you have kidney damage, but the lack of treatment that I often see, because we're avoiding using things like metformin, often leads to the damage that we were trying to prevent in the first place. It's a cheap drug. It's been around longer than I have on this earth, and it works great. I don't have any stock in it because it's $4 a month, right? So it's an excellent medication choice, and it's very cost conscious, and it works great. Other medications that we see commonly used are sulfonylureas, glipizide, glimepiride, things like that, also generally $4 a month. These medications can be very affordable. That stimulates insulin secretion. So now we have one that improves our sensitivity, and we have one that makes us make more than we were previously making. GLP-1 agonists, the kind of new kid on the block, the hot kid, if you will, the Ozempics of the world, they increase insulin secretion and decrease glucagon secretion, and they lead to weight loss and better sensitivity to insulin, which I'm sure everybody in here has a friend or family that's been on that drug, and it can be pretty spectacular. SGLT2 inhibitors, these are drugs that you take by mouth that increase the insulin secretion from the pancreas only slightly, but they primarily increase the urine glucose so that you pee out excess glucose. These drugs have shown almost better than anything I've mentioned already that they can prevent cardiovascular events and kidney damage. So excellent drugs, generally fairly affordable and covered by insurance. The important key fact of all of that, though, none of that generically applies to any one of you individually in this room without me taking time or your provider taking time to individually look at your information and determine if that's the right medicine for you. There is no blanket statement for everybody in here. It's important that we take the time to individually look over your stuff, and I would encourage you to speak closely with your healthcare provider about those things. And ask questions if you do see things online you don't like. It's important to go over those things. Now, the kind of devil in the room, if you will, is always insulin, right? Nobody wants to be told they have to take insulin. I think there's a kind of a misnomer that you have lost at that point, that you're defeated, that you can't come back from that. And I want to encourage you that that's not 100% true. So for individuals with type 1 diabetes or even advanced type 2, insulin therapy may be necessary to help regulate levels effectively. This can be done via injections or insulin pumps, and the insulin pumps generally do a pretty good job of mimicking what our normal pancreas does. There are different types of insulin available, including rapid-acting, short-acting, intermittent-acting, long-acting, and it's important that when you talk to your provider, they help explain that which one you're taking is the right one, okay? Your healthcare provider will work with you generally closely to develop an insulin regimen, and I say regimen because it's a plan. It has to have a plan that meets your needs and lifestyle. So one of the things I like to kind of talk about, one of the things I'm passionate about, are the advances in technology. Technology is great when we get new iPhones and new iPads and stuff, but what about things that help improve people's lives? Well, I've been lucky to be primarily trained in the era of CGMs. I'm sure some of you even have one of these on right now, these continuous glucose monitors that check your blood glucose every 5 minutes. That is much preferred to checking your finger stick, and they are accurate enough to give you a good idea of what's going on in your body. On top of that, we now have insulin pumps that will talk to those CGMs and will mimic a pancreas in all but glucagon. So we don't call them autonomous pancreases or robot pancreases yet, but we're getting close. As you'll see above, there's several different options now for insulin pumps, some of which don't even have wires. They just attach to your skin, and you wear those for 10 to 15 days. The technology involved and the rapid progression of that is something to definitely keep an eye on if you have any interest in that. So in conclusion, diabetes is a complex condition that requires a multifaceted approach to management. By making healthy lifestyle choices, staying informed about treatment options, and working closely with your healthcare providers, individuals with type 2 diabetes, type 1 diabetes, pre-diabetes, one of the other ones we didn't really go over today, can live fulfilling lives while effectively managing their diabetes and essentially prevent the negative effects. So I want to thank everybody in here. I know that was a little deeper than we probably all didn't expect to get a biology lesson, but I hope this detailed overview has provided you some valuable insight in the world of diabetes and its impact on us in Mississippi. If you have any questions, I'm more than happy to go over them with you guys now. Thank you.